Hey guys, it's Marissa. I haven't made a video in a really long time, probably almost a year. A lot of you have been asking how my brain tumors are, so thank you very much. I really appreciate that you guys care. My pituitary tumor is in complete remission now, which I found out just a few days ago. I was taking a targeted therapy to shrink and hopefully totally get rid of the tumor, which it did. Most people have to take the targeted pill for the rest of their life in order to keep the tumor away, but since the pill was making me so sick with nausea and dizziness and just in general I felt bad, my neurosurgeon and I decided to stop the targeted therapy, and if the tumor comes back, just to remove it surgically so that I don't have to torture myself the rest of my life with, feeling sick from taking that pill. So that's that. The pineal tumor is actually a little smaller, I think, than it was. It's 8 millimeters now, and the solid part of the tumor is gone. So now it's just cystic, so hopefully that will never need to be removed. So here's the big, kind of announcement, if you want to call it that, but I was recently diagnosed with a rare connective tissue disease called Ehlers-Danlos Syndrome, hypermobility type. So there's a lot of different types of Ehlers-Danlos syndromes. There's a lot of symptom crossover between the different types, but the most common type is the hypermobility type, which is the one I have. So what is Ehlers-Danlos syndrome? Most people have never heard of it, including the medical field, which is why it took me so long to get a diagnosis. Literally, I went to the conference on Ehlers-Danlos syndrome, and literally pretty much everyone there had doctors tell them they were crazy, it was in their head, they were anxious, they were too pretty to be sick, or just, all these ridiculous things. But I finally got my diagnosis after I kept getting sicker and sicker and kept getting, more little side things happening to me, like easy bleeding, anemia, blurred vision, gastro issues, just so many symptoms, because the problem with Ehlers-Danlos syndrome patients is a defect in their collagen. So the collagen is what usually holds your body together. And with Ehlers-Danlos syndrome, your collagen is weak. So essentially, it's like building a house with weak materials or second-rate materials. So things start to fall apart, they start to break, they start to not function properly. Ehlers-Danlos syndrome, the most, well-known, if you want to say, symptom is hypermobility and your joints dislocating and subluxing, which means partially dislocating. But Ehlers-Danlos syndrome is way more than just those things. You have joint pain, obviously, from all the dislocations and subluxations. You literally can get dislocations just from moving your arm or trying to go upstairs or lifting a glass because your collagen is just so weak. So a lot of people with Ehlers-Danlos syndrome wear braces or KT tape when things are hurting to try and help things stay together better and to reduce pain. But in addition to the joint problems, Ehlers-Danlos syndrome patients pretty much have problems with every major body system because collagen is literally what makes up your entire body, your organs, your skin, your joints, literally everything. So with me, I have like nausea, just really, really bad nausea, all kinds of gastro issues, GERD, blurred vision, sinus problems, easy bleeding, easy bruising, just, the whole gamut of symptoms. And for me, I also have an autoimmune disease in addition to Ehlers-Danlos syndrome. So right now I've been diagnosed just with psoriasis, but they're also looking at maybe some mast cell issues, which is also really common with Ehlers-Danlos syndrome patients. We have what they call, I think, like a trio, some kind of triad of diseases that oftentimes go together. It's dysautonomia, most often POTS, postural orthostatic tachycardia syndrome, obviously the Ehlers-Danlos Syndrome, and then some kind of mast cell activation disorder, which causes all kinds of allergic type symptoms like frequent anaphylaxis, flushing of the face, you know, itching, throat closing, stuff like that. So essentially your mast cells, you can either have too many or they can be activated when they shouldn't be. So that's common with Ehlers-Danlos Syndrome patients. And you know, there's just this whole gamut of symptoms that most people don't understand. They look at people with Ehlers-Danlos Syndrome and other invisible illnesses and say, you know, there's nothing wrong with you. You don't look sick. And most often people don't want you to know how bad they feel. They don't want to be seen as sick. I know that's true with me. I know I decided to film this video because it was one of the rare days where I put on makeup and did my hair and actually put on, you know, clothes, real clothes, besides like sweats. And that's why I haven't come on here to film a video for so long, partly because I felt so bad and so fatigued, which I still feel. But today I got myself dressed up because it's almost Invisible Illness Awareness Week, and I wanted myself to look as not sick as possible. And I'm going to post a photo somewhere, I don't know where, of me holding a sign saying I have an invisible illness, because I want to spread, you know, awareness of the fact that disabilities aren't always visible, which I hate the term disability. I don't know, I just don't like to view myself as disabled or anything. But yeah, essentially that's, you know, kind of the gist of where I've been and, you know, what's wrong with me. And, you know, a little more on Ehlers-Danlos Syndrome. Most people that I've, you know, spoken to end up having a lot of surgeries with Ehlers-Danlos Syndrome too. And you're very fatigued all the time because your body is trying so hard to regulate itself. With the dysautonomia, your body has trouble regulating heart rate and blood pressure and temperature. So, you know, you spend so much energy, your body, trying to regulate these things that it has trouble doing. So that can be very fatiguing. I was also anemic and needed iron infusion, so obviously that was fatiguing. And then a lot of people with Ehlers-Danlos Syndrome have a lot of surgeries. I had 2 surgeries within like a month of each other. My last surgery was sinus surgery. I had like really bad sinus infection on the left side of my face that wouldn't go away. And then it started spreading to my eyes and I was going blind from the infection spreading over there. So I had to get IV steroids, and then I got surgery to take care of that and fix my septum. So yeah, and then now I found out that I have tears from both my shoulders. Literally, I got tears in my shoulders from carrying a backpack, which is something like pretty much everyone can do. And then I have a herniated disc in my lower spine. It's like degenerating, which is like not supposed to happen at my age. So, you know, just kind of stuff like that happens to people with Ehlers-Danlos. Like you tear ligaments, you tear tendons, your joints, you know, are going out before they should, and you often need surgery to repair it. Like I have shooting electric shock pains down my spine because the herniated disc is touching the spinal cord. So yeah, I don't know how good a job I did at explaining all that because it's just, you know, so much. And, you know, if you have any questions, comment down below and I will do my best to answer them. And I just want to thank you guys all for all the kind comments you've left me and all the support. You know, I don't, you know, often feel very well, so I haven't been on here a lot. So if I don't see your comment for some reason, don't worry. I don't hate you. I just don't feel good. So thank you so much for, you know, watching this video and supporting me. And I don't know if I'll be making another video, but yeah, if you have any video requests, I guess let me know in case I decide to make another video and I feel well enough. Thank you guys so much and have a great day.